For some COVID-19 patients, having a negative test result doesn't mean the end of the disease. There are lingering symptoms of COVID-19, from physical symptoms like fatigue to mental health problems like depression, anxiety, and even struggling to focus and think. This condition is called long COVID, and it's not necessarily happening to people who've had severe infection. Why are some people not recovering? That's the question we hope to answer. I'm Dr. Freddy Gomez. You're watching CNN Philippines. Most people recover from COVID-19 within 2 to 6 weeks, but some struggle with the symptoms weeks or even months after they test positive for the virus. Later on in the show, we'll be joined by people who suffered from it. But first, let's talk to Dr. Rioloida Diola. She's a pulmonologist at De Los Santos Medical Center and at the Lung Center of the Philippines, and she's here to tell us more about this condition. There are a growing number of patients who experience lingering symptoms of COVID-19, and they've been coined the long haulers. Now, Doctora, when is a person considered a long hauler?
Most people with COVID-19 improves after weeks of illness. However, there are some who do not. Long haulers are COVID-19 survivors who experience health issues more than 4 weeks after first being infected with the virus.
Okay, so itong mga long haulers are those who experience symptoms after recovering from the disease. And these symptoms can appear even weeks or months pa nga after the infection. Now, I think it's important for them to know kung ano itong mga symptoms na to. Could you explain to us, Doctor, kung ano yung mga ito?
Most of the time, this patient does not know that they are experiencing until they seek medical advice. So the most common symptoms include tiredness or fatigue, even with the slightest move. They cannot explain why they get tired easily, even though they are still young or athletic. Some experience difficulty of breathing or cough or shortness of breath.
Because the most common symptom reported is yung chronic fatigue, ika nga. But symptoms may vary among patients, ano? But, Doktora, marami rin ang nagtatanong, and you brought up that point, gaano katagal itong symptoms naglalast on average?
With my practice, I have already experienced until 3 months. Until 3 months pa lang yung kanilang long haulers, especially if they have very good physical rehab or activities at home, and especially if they are with their family. One of the reasons that they have depression is they feel alone during the time that they are confined in the hospital. So, minsan sila yung mas nagtatagal nagkakaroon ng long haulers. But if they go back to their family, if they go back to their previous work, sometimes it's just like 3 months. But some go as long as 6 months or more. So,
yes.
Yes, I have experience even after 8 months, they still have chronic fatigue or shortness of breath.
During this whole time na nakaka-experience sila ng symptoms pa rin ng COVID, contagious pa ba sila?
That's also one of the frequent questions that I also heard, no? So, because I have patients asking for clearances to go back to work even if they experience COVID symptoms. As for if they are contagious, it is not very likely as long as they surpass the quarantine stay or isolation stay as advised by the DOH guidelines. They are no longer contagious.
And remember, just because you're not infectious and have a negative test result doesn't necessarily mean that it's the end of the disease. Even those who've had mild COVID-19 infections suffer from long COVID. Ngayon, ang tanong, Doktor, ng marami is, bakit ito nangyayari sa kanila? Bakit sila nagkaka-long COVID habang yung iba naman, hindi?
Yeah, I understand, no? So, since COVID-19 has an inflammatory response in the body, some who have mild COVID-19 infection suffer from long COVID. Still, researches are ongoing as to why this is happening. But with my experience, these patients have mild COVID but still suffer long COVID are the ones who have previous disease like asthma or COPD or smokers. Of course, COVID strongly affects the lungs. And asthma is also an inflammatory response, hence they suffer from long COVID.
But just as those above 60 or those who have underlying conditions are at higher risk of catching COVID-19, are there people who are at higher risk of developing long COVID? What do you think, Doctor?
as to what I have observed, patients who have severe or critical COVID, who have intubated during their time of the COVID infection, have more predisposition of acquiring long COVID because their lungs have been severely damaged. So also, patients who are elderly also have higher risk since these individuals cannot tolerate exercises which can help recovery of the lungs.
Okay, so if you're not recovering as quickly as expected, message to our viewers, don't panic, but please consult your doctor right away. So let's say you develop long COVID. What are your advice to those people, Doctora? What should they do? Are there medications that are still given even for that long period of time?
My advice is to seek medical advice early as possible, hopefully to lessen the duration. So with this, we can give inhalers for those experiencing difficulty of breathing, medicines for the cough. We can also refer these patients to pulmonary rehabilitation.
Now, doctor, we've been hearing reports in other countries that these long haulers are actually getting relief after being vaccinated. Do you think vaccines are helping in this situation?
Actually, vaccines are also helping us. Regards to the Philippine data, there's still no basis with regards with that. But vaccinations with flu vaccine, with pneumonia vaccine would really help with regards to long COVID, since the predisposition of acquiring new infection like pneumonia or flu are lesser. So the symptoms would be much lesser as to compared if they don't have another vaccine.
Yes, that's correct. That's why we can't stress enough. If you're eligible, please get vaccinated as soon as you can. The sooner we get vaccinated, the sooner we can reach a state of normalcy that all of us really want. Now, while the vaccines are still being rolled out, cases are still steadily on the rise, and we need to be mindful of infection. If you or someone you're living with is experiencing any of these symptoms, isolate or quarantine right away, and please consult your doctor. Thank you so much for joining us, pulmonologist Dr. Rioloida Diola. Remember, long COVID is an increasingly common condition. Let's always follow minimum health standards and do your part to protect yourself and those around you. When we return, we talk with some long haulers about their experience. Stay with us on MedTalk Health Talk, your partner in healthcare, only here on CNN Philippines. Welcome back to MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. From reports of exhaustion after just a short walk to struggling to focus at work, more COVID-19 patients are facing long-term effects of the virus. We're grateful to have with us today two COVID survivors to share with us what it really means to be a long hauler. With us is Mr. Jamil Bautista. He's a freelance producer as well as a cameraman. And we also have Mr. Norbs Portales, a theater artist teacher and acting coach for TV as well as film. Now, I'll start first with Jamil. You work as a freelance producer as well as a cameraman. Sa tingin mo ba or naalala mo ba kung na-infect ka with COVID-19 through work?
Nung time kasi na yun, continuous pa rin yung trabaho natin as cameraman. No? So, isa yun sa possibility na tinitignan ko. And also, since ako yung lumalabas ng bahay para mag-groceries, isa rin siyang possibility. Anyway, regardless kung sa work or dun sa pag-grocery ko nakuha, feeling ko kasi ang naging mistake ko nun is yung sa health protocol na pagbababa ng mask. Kasi may time na during shoot, kakain kami or kaya pag nag-groceries, uminom akong tubig. And siguro, alam naman natin na pag pinababa mo yung mask, malaki yung makuha talaga yung COVID.
Okay, so I think that's very important to note na hindi mo talaga masasabi kung saan mo siya makukuha. How about you, Norbs? Naalala mo ba yung eksaktong moment or at least rough estimate kung saan ka na-infect?
I think nakuha ko ito sa trabaho. Pero although we're in a bubble and all of us were also negative, tested negative. I think tama yun yung protocol, yung dumating sa panahon na nag-relax kami kasi negative kaming lahat So kumain kami together, binaba yung mask. And I think yun yung pinanggalingan ng virus.
That's why we want to remind everyone that COVID-19 is easily transmissible. You really never know where you can catch the virus, so the best thing you can do is take extra care. Always mask up and practice proper social distancing. Punta ulit tayo kay Jamil. What were your initial symptoms like? Was it really obvious na or malala na kagad ang mga simptomas mo?
Initially, yung napansin ng wife ko na symptoms ay yung rashes, no? Kasi nagulat lang siya nung pagubad ko ng shirt, ang dami kong rashes sa likod, which is unusual. And then, a few days later, ayun na, lumabas na yung cough and yung fever. And then, ayun na nga, nag-progress after 5 days nung initial na symptoms, which is yung rashes niya. Nagsimula na yung diarrhea, yung hirap sa paghinga.
Okay. How about you, Norbs? Ano naman yung progression ng mga simptomas mo?
Ako nagsimula, parang allergic rhinitis lang. So akala ko, okay, inom lang ako antihistamine. Tapos, ay hindi nawawala yung kati ng throat ko. The following day, nilalagnat na ako. And then, nung nilagnat ako, nagmask na ako sa bahay kagad. Sabi ko, oh my God, COVID siguro to. And then, after 5 days, nagpa-test ako, tapos confirmed, COVID nga.
The symptoms for COVID can be varied talaga, and it can be different from one person to another. I know both of you were tagged as severe COVID and eventually both of you were hospitalized. I'll start now with Norbs. When you realized that you tested positive para sa COVID-19, what was your train of thought? Pumunta ka ba kagad sa ospital? Did you try and wait this out at home?
Well, actually, bago ako na ospital, nag-11 days pa ako na quarantine sa bahay kasi gusto kong, una, ayokong gumastos, pangalawa, I knew some people who survived the virus staying at home. So I thought I could, no? Ang una kong ginawa, I stayed in contact with the doctor, and then bumili ako ng oximeter, and then binigyan ako ng meds, and then nung bumaba na yung oxygen ko to 87, doon na, kinailangan na akong i-hospital.
Now we'll go to Jamil. I know you also have maintenance para sa diabetes, ano? What were the medications and treatments that helped you the most?
Before ako nagka-COVID kasi hindi ko masyadong siniseryoso yung comorbidity ko, yung diabetes, no. Typical naman, may kinokonsult akong doktor noon. Talagang nagte-take naman ako binigyan niya ako ng gamot for diabetes, pero hindi ako good patient nung time na yon. So, nung time lang na nagkaroon ako ng COVID, and doon lang ako naging seryoso doon sa pag-inom ng mga gamot. Pero what helped me during nung time na may COVID ako is nag-research kasi yung wife ko ng mga vitamins and supplements na pwedeng i-take para malesen yung effect ng COVID. Although, ang nangyari, matindi pa rin yung naging effect sa akin ng COVID.
So, proper maintenance of any pre-existing condition is definitely important, especially you don't know when you might catch COVID-19. Now, in both your cases, the disease didn't end when you both tested negative. You experienced extended symptoms long after you caught COVID. Jamil, what symptoms emerged? Nakaranas ka rin ba ng mga prolonged fatigue dahil ito ang one of the most common symptoms ng long COVID?
Yung prolonged fatigue, masasabi ko hanggang ngayon, almost 1 year na yung pagka-infect ko ng COVID. Andun pa rin, no, yung fatigue. Pero mas nararamdaman ko ngayon yung difficulty ng paghinga kahit sa mga mababaw na task. Yung mga dating nilalakad ko na kaya ko naman ng dire-diretso or pinabike ko ng dire-diretso, napansin ko na mabilis na akong humihinga. Lagi ko naman itong sinasabi dun sa endocrinologist ko na yung left na binti ko namamanhid pa rin.
Now, Norbs, what was your feeling when you noticed na hindi nawawala yung mga simptomas even after the allowed time frame?
So, ang tagal na nung lagnat ko, no? Tapos, at some point, hindi na nga ako makahinga. At some point, hirap na ako maglakad. Hirap na rin ako magsalita. So, kaya na-hospital ako. After 11 days of home quarantine to, no? Tapos, pagpunta ko sa hospital, 16 days ako sa hospital. So, actually, if you ask me, kakalabas ko lang sa hospital 11 days ago. At ano yung mga nauwi ko na residual symptoms from COVID? May blood clot ako kasi parang ang normal blood daw 0.5, yung blood ko 0.9. So may blood clot ako, maga ngayon yung right leg ko. Hindi ako makatanggap pa ng work kasi mahirap, masakit yung leg ko, parang may naipit na ugat, ganun yung pakiramdam. And then yun, minsan hinihingal din.
So both your experiences are obviously very different, but the same point here is that there was long COVID even after the perceived time frame. We talked to Jamil and Norbs on how they've managed long COVID. All of this after a short break. Our goal here on the program is to keep you on the path to good health. You're watching MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. The COVID-19 pandemic has left some patients with lingering symptoms, and the sooner we know how to treat this, the better we can care for each other. Today, we talk to some long haulers on how they're managing the condition. I'll start first with Jamil. What are doctors giving you for medications to address your long COVID? And does your medicine for your comorbidity, is it being followed strictly now?
After ko lumabas ng ospital when I got COVID, yun, naging seryoso na ako dun sa pagta-take ng mga medicines ko for my comorbidity na diabetes. No? And ang lumipat din ako ng doktor ko, yung doktor dun sa PGH na nagbantay sa akin during my stay there nung nagkasakit niya ako ng COVID. So closely monitoring yung ginawa niya sa akin for the next 6 months. And then ngayon, ang bidin lang naman niya sa akin, wag mag-fail doon sa pag-inom ng mga gamot ko for diabetes. No? Tinatanong lang ako lagi ng doktor ko kung ano yung nararamdaman ko after taking my meds, and then ina-adjust niya yung mga dosage. Kasi nga, before COVID, hindi kasi ako masyadong nag-monitor.
How about you, Norbs? Kamusta ka na ngayon at how are you managing your condition?
So right now, I'm taking 17 meds a day. I'm also using compression stockings for my legs kasi nga namamaga pa rin siya. Breathing exercises every day. So mahilig akong kumanta, so sinusubukan kong kumanta every day para naman yung breathing exercise hindi boring at masaya. At the same time, kailangan maglakad, kailangan magpa-araw, take vitamins, at saka I think positive thoughts kasi part din nung magpapagaling sa atin yung mabuting mental health.
Yes, that's very true, Norbs. Mabuti na mention yan. It's a good outlook in life that will help. And remember, there are also a lot more simple steps that you can take to take care of yourself, such as getting enough sleep, eat a heart-healthy diet, as well as to plan your exercise. Now, there are a number of reports that long haulers are getting some relief after their vaccine. What are your thoughts on this? I'll start first with Norbs.
Magpabakuna kayo kasi ayun, pipigilan kayo nito na ma-ospital. Pwede pa rin kayo magka-virus at pwede pa rin kayo magkasakit. Huwag nyo nang hintayin ma-hospital kayo, please. So, makinig tayo sa mga experts. Take the vaccine.
How about you, Jamil? What's your opinion on this?
Yung vaccine, syempre, katulad na sinabi ni Norbs, no? Importante talaga yon. Hindi lang naman para sa personal. Nakikita naman natin sa mga informational drive na ginagawa ng government at ng mga health workers na kung merong chance na magpa-vaccine to help not only yourself, not only your family, kundi pati na rin yung buong community natin.
Yes. And before we go, what message do you want to share with our viewers about your experience? Let's start here with Norbs muna.
Siguro, ganun pa rin, sundin natin yung protocols. Huwag tayo magsinungaling sa health declaration. Wear our masks properly. Isipin natin, we're not only responsible for our own health, but for the health of people around us. So you don't want to bring the virus in your home. You don't want to spread the virus with strangers. So be responsible not just for yourself, but for the community.
Thank you very much. And how about you, Jamil? You have a message for our viewers?
As much as possible, kahit nga relax na yung mga quarantine protocols, kung talagang hindi naman kailangan lumabas. No, hindi talaga advisable. Bilang ako, nakabalik na ako sa work. hindi pa rin ganun ka-okay yung sitwasyon sa labas. Kasi karamihan naman ng may concern sa health protocols, lumalabas lang yan pagkakailangan talaga. So yun pa rin, minimum health protocols pa rin talaga yung makakatulong sa atin.
Maraming salamat, Norbs at Jamil, for sharing your experiences with us. Your stories have helped enlighten other people, especially those who are going through similar journeys. We're here to help build a healthier future for you. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. Be kind to one another and stay safe.